she gave me strength. She gave me energy. Watching her dance in her little tutu around the hospital room and seeing the joy on her face when the nurses would bring in cartoons, what have you. I was living vicariously through her.
How can a child help her father recover from heart transplant surgery? How important is it for parents to allow their children to be part of the recovery process? What advice does a heart transplant recipient have for others facing being listed for transplant when they are the parents of a young child? Welcome to Heart with Anna. I am not Anna Jaworski. I am Anna's husband, Frank, and I'm the guest host for Heart Dad Sundays in February of 2023. Anna and I have an adult child with a single ventricle heart, and that's why I'm the guest host of this program. Today's show is a child's role in transplant recovery for a heart dad, and our guest is Paul Cardall. Paul Cardall was born in 1973 with only half a heart. He had his first surgery a few hours after birth and 2 more surgeries at age 13 and 14. As a child, he took piano lessons, but wasn't keen on practice. As a teenager, he started composing and became obsessed. He was hired to play at weddings, in restaurants, and department stores. In 1994, author Richard Paul Evans invited him to compose a musical adaptation of his #1 New York Times best-selling novel, The Christmas Box, which helped launch Paul's professional career. In 1999, Paul founded Stone Angel Music, where he released his albums independently. His albums debuted at #1 on 8 Billboard charts and have earned over 2 billion streams on Pandora alone. By 2008, Paul's health had declined to the point where he was placed on the transplant list. Following his transplant in 2009, Paul experienced a newfound energy. Today, he lives a very full and active life as an entrepreneur, recording artist, podcast host of All Heart with Paul Cardall, husband and father. Heart with Anna loyal listeners will remember Paul from season 16, when he was a guest on the program entitled The Broken Miracle. Welcome back to Heart with Anna, Paul.
It's so good to be back. Thanks for having me.
Paul, at the end of your introduction, we discovered that you're a father. Let's back up and talk briefly about your wife, when you got married and when you decided to start a family.
It's a very good question, and I'm actually in a second marriage. But when I had my original heart defect prior to the heart transplant, I married an amazing girl from my neighborhood who ended up being a nurse. And that was a really beautiful thing to have a nurse and be a person who has congenital heart disease. She was very capable and we were very close. And together we had 2 beautiful children. Most people are used to having a child that is sick and you're taking care of that child. But when you're the person that is sick and the child is on the other end, it really puts that child through quite a bit of misunderstanding about life. My daughter once said, girls wear makeup and dads wear oxygen. She was under the assumption that all dads wore oxygen, and that's because beyond climb. And it ended up being this beautiful way of teaching her about life and the challenges of life. And I explained that not every dad, as she learned from her friends, had some type of illness. But the beautiful thing was my wife, her mother, also had a father who was often ill and had a mother who had cancer when she was younger. And so she was able to communicate with our daughter in such a beautiful and profound way that she had also taken care of her mother. So this was a great opportunity for my daughter to not only have a normal childhood, but to recognize the value of life, how precious it is. And of course, when you're young, you don't fully comprehend or understand that. You just survive and you adapt to this circumstance around you. But of course, it is difficult because you want to be healthy for your child.
Absolutely. Many people who have left-sided heart defects, especially critical congenital heart defects, worry that their child might be born with a heart defect too. Was this something that concerned you and your wife?
It wasn't a concern because my diagnosis at birth was not genetic. I only had a single functioning ventricle. It was cold, double inlet left ventricle, transposition of the greater vessels, had pulmonary stenosis, I had a large aseptal defect. But this was not something that was genetic. But of course, every time we went to get an ultrasound, because we did experience several miscarriages, every time we went for an ultrasound, we would check that heart and make sure that heart had 4 chambers, unlike the child's father that only had 2. And fortunately, God blessed us with 2 healthy children.
I understand totally. Alex's older brother, Joey, who was heart healthy when he started doing athletics and taekwondo, and swimming in high school, he had a cardiac ultrasound as part of his clearance to be in those sports. And we were very cautious and concerned about what they'd find. And obviously it came out okay. But yeah, it makes you hyper aware.
Absolutely. That's great. That's great.
So becoming a dad is a milestone you never forget. Can you tell me about your daughter's birth and what it meant to you?
We had countless miscarriages, which was really disheartening for both of us. And we were unsure when that time would be that we'd actually have a child. So it was building up momentum. And I was always fearful of bringing a child into the world because I wanted to live long enough to be able to be there for the child. And finally, when the pregnancy took and my oldest at the time, Eden, was born, I just remember it just being a supernatural experience. There's a couple times where I've had supernatural experiences, and those have been when I've been in the hospital. All the love in the world is surrounding you. You're overwhelmed by the community and family and people. And then when you are in the hospital watching your wife go through her own experience and then having the child come through, and it's just a miracle what happens. Now, my second child, when she finally came through, this was after my heart transplant. So she wouldn't even be alive had my donor not signed up. We gave her the middle name of my donor. But when she was born, we were really scared at the moment because the cord had wrapped around her neck. And for a couple minutes there, she wasn't breathing. And my wife at the time, being a neonatal nurse, she knew what was happening. And you could see the intensity on her face. So I was scared. And I had just survived a heart transplant. And so finally they got the cord unwrapped around Eliza and she started breathing. All the color came in and it was miraculous the way the doctors revived her. And there was just this beautiful moment, a very spiritual moment of seeing life come back into her the way life had come back into me.
Absolutely. I have some feeling for how your wife felt because when Alex went through his birth and his first 2 surgeries, I was working as an adult cardiac intensive care nurse. And so I knew what to expect. I thought I did, but it's different when it's your own child. So it must have been terrifying for her.
Wow. And what a remarkable job you've had.
I love what I do.
Home Tonight Forever by the Baby Blues Sound Collective.
I think what I love so much about this CD is that some of the songs were inspired by the patients.
Many listeners will understand many of the different songs and what they've been inspired by. Our new album will be available on iTunes, Amazon.com, Spotify.
I love the fact that the proceeds from this CD are actually going to help those with congenital heart defects.
Enjoy the music.
Home Tonight Forever.
This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
You are listening to Heart with Anna. If you have a question or comment that you would like addressed on our show, please send an email to Anna Jaworski at anna@hearttoheartwithanna.com. That's Anna at hearttoheartwithanna.com. Now, back to Heart with Anna.
Paul, you were in your 30s when your health declined to the point of needing a transplant. How did your declining health affect your family?
Well, it affects any family when you have a family member who's in decline, and there's a lot of fear. There's a lot of questions about life and what it all means. And those that have a religious background turn to God. Even those that don't start to think about God. What is it all about? And I was born into a religious home where I was taught that this life isn't the end, that there's a continuation onto the next life. And so whether that's a reality or not didn't matter. It gave me hope that life would go on. And so in the moment and in the present, we would just work together to create memories. We would invest in memories over buying things that you can't take with you into the next life. And my parents would always use my illness as a way to communicate how fragile life is and not to take it for granted. And I always knew I would need a heart transplant. I just didn't think it was going to come in my 30s. I thought maybe in my 50s. But every day of my life, doctors, cardiologists would say, we're not sure how long to live. And I used to kind of laugh and tell my mom, I think they just say that so they sound like superheroes when you keep living and we give them all this glory. But it makes a family close. It can also tear a family apart. Parents can be at odds with each other. So I understand and have compassion with that. But in my case, my community, my family came together. And even though I'm suffering and I'm scared, it became one of the most spiritual, uplifting moments. And lately there's a psychologist out of Canada, Jordan Peterson, and he resonates with me because he said, life is not about being happy. It's about suffering. Because in our suffering, we recognize that we're loved and we love people. And then we recognize our life has meaning. We are living for these people and they are living for us. And that is the purpose of life. And unless we go through these hard things, C.S. Lewis, it is impossible to know love unless we understand pain. And so it's an education. And for me and my family, it became a beautiful refiner's fire of what matters most.
Do you find that the lessons that your parents taught you about the fragility of life were things that you passed on to your daughters?
I'm trying. My parents did a better job. They're still together after 55 years. It's a different time. There's a lot more things trying to divide the family. And I'm trying to pass those things on, even though after my transplant, I went into a pretty heavy depression, survivor's guilt, PTSD. My marriage kind of closed a season, closed a chapter. My wife, who was the nurse at the time when I got the transplant and had these beautiful girls with, we're still very close and very tight, but we both have remarried people that are really the best for us, and we're the best for them. And our children have now brothers and another sister, and these are the things we couldn't provide them. But through the tragedy of divorce, and yet through the miracle of staying persistent in trying to make the most of it, they have a life we honestly could not give them. So it's an irony, but it's kind of like for me to live, somebody had to die. And these things happen in life, but I'm a big believer in God, and it doesn't matter who that God is to you, but God for me fixes everything we break. And we break a lot of things, and he tends to just fix it because my kids are more important than my own selfish desires.
I get what you mean about the irony, especially. One of my favorite short stories is called God is an Iron. And the title means a person who commits a felony is a felon. So a person who commits an irony is an iron. And so God specializes in irony. And we all feel that.
I love that.
Yeah.
Straightening things
Absolutely. So how long were you listed before you received your gift of life?
I was listed for 385 days. I was O positive blood, which is the most popular majority of people that are on the waiting list, and the least amount of people that donate. So it was a catch-22. We weren't sure if I would even pull through the first month. But in fact, on Christmas, I'd been waiting 3 months, and they called me in on Christmas Eve and said, "We have a heart for you." And I made it all the way to the operating table. And as I was about to go under, they came and they said, "Well, there's a problem with the heart. There's an aneurysm on it, but we're not sure if you'll get another opportunity. So do you want to take the heart? And then we can operate on this heart later." I'm like, I've had a dysfunctional heart my entire life. I think I'm going to wait. But I also had to take into account my daughter is celebrating Christmas today. And I'm not dying on Christmas. So I would have rather risked leaving and not making Christmas one of those horrible, tragic days, but a day of celebration of birth. So those are the decisions you have to make. And finally, September 9th, they went in and took out my old heart, which was severely damaged, the size of a football. It's a miracle.
Absolutely. It's fascinating to me that you counted the days, the exact number of days you were on the waiting list. That reminds me of people I know who spent time in a combat zone who do the same thing. They know exactly how many days they were there.
Yeah, you're at war trying to survive.
So how old was your daughter when you were listed? How aware was she of your condition? Did she understand?
I don't think she fully understood. She was 3 years old when I was listed. She was 4 when I received the heart. We didn't keep her in the hospital too often. She would come to the hospital. The good thing is, because I had a congenital heart defect, the only place where I could really do the surgery was in a children's hospital. So at least it wasn't an adult hospital. So when she would go there, there was child life. There were pictures of Elmo everywhere. We had, popsicles. And so she wanted to be there. And she always knew I had oxygen anyways. So there was really no difference. I was just staying overnight at some hotel to her that had lots of treats. But finally, after I had my surgery and I was in the intensive care with all the tubes, we could have had her come in earlier to see me with everything in me. But I waited until they pulled the majority of the tubes out of my body. And so when she came in, I didn't look like Pinocchio. I looked like a real boy.
I think that was probably a good choice. When I worked as an ICU nurse, I saw family members who were under a normal age limit come in to see their family members who'd had open heart surgery. And some of them were very traumatized. I think you made a very good decision to wait.
Yeah, and a lot of that was from Lynette, my wife at the time, because she also worked in the hospital, understood the trauma that is inflicted in the future from memories of seeing things. They're not always healthy.
It's not that they see it over and over again. It's they see it one time and they play it in their mind over and over again. Yeah.
Yeah. But my daughter, my oldest, has always been worried about me. Even though I'm really healthy and she knows I'm healthy, she still continues, unlike the other one who didn't know that time period or experience that time period, she continues to worry about me.
How old is your oldest daughter now? 17.
She's 17. Yeah, in fact, she just released her first single. She picked up on music like me, which I didn't have any power over, but she just released her first song. So check it out, everybody. Eden Cardall. And I'm very proud of her.
Anna Jaworski has written several books to empower the congenital heart defect, or CHD, community. These books can be found at Amazon.com or at her website, www.babyheartspress.com. Her bestseller is The Heart of a Mother, an anthology of stories written by women for women in the CHD community. Anna's other books, My Brother Needs an Operation, The Heart of a Father, and Hypoplastic Left Heart Syndrome, a handbook for parents, will help you understand that you are not alone. Visit babyheartspress.com to find out more.
Heart to Heart with Anna is a presentation of Hearts Unite the Globe and is part of the Hug Podcast Network. Hearts Unite the Globe is a nonprofit organization devoted to providing resources to the congenital heart defect community to uplift, empower, and enrich the lives of our community members. If you would like access to free resources pertaining to the CHD community, please visit our website at www.congenitalheartdefects.com for information about CHD, the hospitals that treat children with CHD, summer camps for CHD survivors, and much, much more.
So, Paul, how can a child help her father recover from heart transplant surgery? Anna showed me a video you sent her. Your daughter was at the hospital with you, in bed with you. Can you tell us what it meant to have her with you on your transplant journey?
When you're with your child, you don't think about your own illness because you're focused on the joy that they bring to you. And we have such a beautiful, tender relationship. And she gave me strength. She gave me energy. Watching her dance in her little tutu around the hospital room and seeing the joy on her face when the nurses would bring in cartoons, what have you, I was living vicariously through her. I don't know that we can really prepare our children for what they witness and what they experience. I think we need to just ask them, how are they feeling? What do you see? Are you curious about any of these buttons? Are you curious about the tubes? And when I was at home and had the oxygen tube, it was a 50-foot, as many of you know, because the oximeter is so loud that if we had it in the room, it would just vibrate. So I was attached to it with a 50-foot cord all the way down the stairs. So at the time, as a 3-year-old, if she wanted to find me, she would follow the leash. And eventually she would find me. And sometimes if I wasn't paying attention, she would come in there and she'd pick up my cord. Like, Dad, if you don't come play with me, I'm going to turn off your nose.
That's hilarious. I love it.
So, yeah, I mean, children don't know anything different. And so I went from being sick to getting healthy. Most of us watch our parents go from being healthy to sick.
That's cool. And that's a good way for her to frame it. Excellent. So, how important is it for parents to allow their children to be part of the recovery process?
I think it's very important because they need to understand in the simplest terms and in the simplest expressions what's happening. And I don't think we need to go into the technical details of getting a doctor in to explain things. I think we can use art therapy. Like, I gave my daughter some paints and I said, will you paint Dad's heart? And she painted this big image and it was purples and dark colors and blacks. And this was what she was doing. And she was processing what she was seeing. And then we talked about it. Your heart is really, really sick. I said, you're right. And then after I got the new heart, I said, I got a new heart. Let's paint. And she painted a pink, beautiful pink colors. So through art therapy, simple things like asking your child to draw what she's feeling or go over to the piano and play what you feel. I don't know how to play music. Well, go hit the piano keys the way you feel. They'll sometimes pound on it, or they maybe just hit a couple notes, light notes, or they'll go over there and try to be funny. They're expressing themselves, even if there's no melody. So come up with something creative. I'm an artist, so I try to come up with things creative that the child can do to express their emotions. And we need to tell our children it's okay to be angry. If you're angry, tell me it's okay. Because so often children think they're going to get in trouble if they're angry. But we need to let them know this is not because of them. This is not their fault. This is part of nature. And yeah, I think they pick up on it.
Sounds like you addressed her concerns and gave her information at the level she could understand. This is one of the things that I do with patients now. If patients want to know more, I tell them more. If they don't want to know technical details, I don't tell them. So you answer their questions, you satisfy them. It sounds like that's what you did with her.
Yeah, nobody gives us a book or a manual on how to raise kids, particularly in a time of crisis.
And if we had kids, we wouldn't have time to read it, would we?
Right.
So, what advice do you have for others facing being listed for a transplant when they are the parents of a young child?
First off, I don't think you should be afraid of a heart transplant because many of the congenital heart surgeries are a lot more complicated. This is a pretty simple procedure. The challenge is getting into your anatomy, but I've spent time recently at the cardiovascular clinical trialists with the FDA commissioner and all the top surgeons back in Washington, D.C. with the French embassy. And transplants are so advanced now, and they now know how to help people with congenital heart disease get these in such an effective manner to where there is no internal bleeding. It's just a matter of timing and working with your doctor. So don't be afraid of the transplant. For years, I felt like I was driving around a pretty cool pickup truck, but my friends thought it was like grandpa's old beat up truck at the farm that nobody wants to drive. I thought it was a cool truck that I was driving around inside of me. And so you have to go to the surgeon and you hand them over the keys. You go to sleep and you wake up with the keys to a Porsche. So it's very difficult then to figure out how to relearn to breathe for the first time. You have 2 ventricles, you have 4 chambers. But, again, when it comes to your children, in our case, of course, this was dad being sick to getting well again. And part of the process was, again, I turned back to art. We would cut out paper hearts. We would try to talk about it, explain it. We would sit at the piano and make up songs and just be there to answer any questions they had. And in fact, after I got home from the transplant and was well, first thing we did was our neighbor lent us their convertible. And we took the convertible up the canyon and we went hiking with our daughter for the first time ever. So that experience alone showed her that even though we were going uphill, we were having a good time in the car. And then when we got to the mountain, we parked and we continued to walk up the hill, and it was symbolic. I told my daughter, in life, we're always going to be walking uphill. It's always going to feel like we're going uphill. But when you do it together, there's so much happiness and joy. Yeah.
Well, that's exactly along with the Jordan Peterson quote. That's the same framework exactly. So,
yeah, it's good also to reach out and listen to people like Jordan Peterson, positive people who are looking at life not through quick self-help techniques, but who are honest and real and recognize the meaning of pain. C.S. Lewis, whether you believe in biblical scripture or not, those things are always inspiring emotionally and can get you through things.
Absolutely. All the good stories in the Bible are about passing through difficult times, through painful things.
Yeah. Taking the ring to Mordor,
Absolutely. Actually, I was from The Princess Bride.
Yep.
Where was life is pain. Anybody that tells you different is trying to sell you something.
Yes, because everybody doubted Wesley that he would ever be able to get back with the love of his life. Yeah. And I keep hearing inconceivable. The fact that you could actually take the heart out of a person and then put a new heart in and raise them from the dead. Inconceivable.
Excellent. Very good.
So anything is possible.
Well, thank you. Thanks for coming on the show today, Paul.
Oh, my honor. It's a privilege, guys. And I really admire Anna and what she's doing to bring awareness and education to families.
Well, to be honest, I admire my wife. Lucky I could get to be a little part of it too.
Well, it's good to talk to you, Frank.
Heart, Paul. Well, that concludes this episode of Heart with Anna. Thanks for listening today. Please tune in tomorrow for the Medical Monday episode. Until then, please visit us at www.heartsunitetheglobe.org. And remember, my friends, you alone.
Thank you again for joining us this week. We hope you have become inspired and empowered to become an advocate for the congenital heart community. Heart to Heart with Anna with your host, Anna Jaworski, can be heard at any time wherever you get your podcasts. A new episode is released every Tuesday from noon Eastern Time.